We have all taken a bus before, haven't we? Yes, we have. So, having established that we have all taken a bus before, and as a matter of fact, some of us might have a particular bus that we love to patronize every now and then. And the reason why we love to patronize these buses might be varying. For some of us, it's because the buses are well maintained and it never breaks down or cause unnecessary delays on our journey. For some of us, it might be that, oh, the drivers are kind and they are safe drivers. They make us feel safe when they are driving. And for others, it might be like, oh yeah, the conductor doesn't stress me because they always have change. Okay, so all these are varying reasons why we love to patronize that particular bus that we love to use for our daily commuting or for our long distance journey. And as a matter of fact, if I were to ask us to give names, we will start naming varying companies. Okay, now think of the hospital as your favorite bus company or that favorite bus that you love to take. And in this hospital, we have the clinical and non-clinical team. That's your nurses, your doctors, and everyone else that work in the hospital as your bus driver, as your conductor, okay? And then think of yourself, the passengers in your favorite bus, as the patients or service users in this hospital. Now, some of the questions you tend to ask, oh, is the driver safe while considering a favorite transport company to use for your journey? It's the same way when you are patronizing a hospital, you should try to find out who is responsible for what when things go wrong. Okay? Stay with me. Now, in the same transport company, I'm sure we have things like the vehicle inspection officers that ensure that that bus you're taking is up to standard. It has the necessary things to look after you in terms of an emergency, and when something goes wrong, they try to look what happened. Back to our analogy. In the hospital, it is within your rights to know who is responsible should anything go wrong. And it will interest you to know that we have people that are likened to the vehicle inspection officers that work to ensure that the people looking after you, that is your nurses and doctors, are held accountable for their practice, and that is clinical governance. So clinical governance is that body that ensures that care is safe, is regulated, and it's accountable. So should you ever find yourself in a hospital, you are allowed to ask these questions. Who is accountable should anything go wrong during the course of my care? And yes, every functional hospital should be able to have somewhere that you are able to have your concerns heard or your needs met. So if you find yourself anywhere in the hospital, you are allowed to ask that, because every functioning organization should have some sort of governance that oversees the affairs and ensures that your nurses and doctors are held accountable and that the care that you receive is fair and safe. And if you are unhappy about anything that has gone on during the course of your care, it is within your rights for you to demand for an explanation. Okay, so keep listening to Dashing Depths Nursing Insights, and for now, Nachi